Hello, we are AI-powered health app, and the problem we're tackling is people ignoring symptoms to high cost of healthcare, which leads to health complications, and further spending more time and money on diagnosis. And lastly, misdiagnosis, which is due to lack of accurate information on the patients. So the struggles faced by clinicians and patients are lack of precise information, follow-up after surgeries, and like signs and symptoms cause complications as well, and hospital overcrowds. So we are BYS, it's short for by your side. And what our app offers is it allows you to record your symptoms, pain, and other irritations and provide answers you may be seeking and suggest solutions. Uh, it's an AI that learns your habits and uniqueness of your personal health status, and it is then able to analyze your data collected and recommends healthcare to your needs and allow early case detections. And the benefits for patients are timely medical attentions, accurate directions of medical treatments, and they will save time and money as well. And for clinicals, it's the big data for patients, and they'll be able to obtain accurate data on the patient's history as well. And how it works is that patients will create profile, and the data input there will be a data input, and then the AI computing will analyze the data and will in return it will suggest recommendations. So the data input can break down into the 4 categories: entry, auto input, manual input, and clinics. And this is how the data is going to flow through our app, through clinics, hospitals, and such, as you can see. And this is how the AI interface functions will look like. For example, when users journalize their symptoms and injuries, the AI will analyze and reply. For example, you've had this injury 4th time in 2 years. It could have possibly affected your lower cord, etc. And it will suggest whether you should seek medical attention or not. And it works same for COVID-19. It will give you updated newsletters, and it will tell you preventive measurements as well. And lastly, daily notifications usually in our users. So we'll be giving their analyzed health report on their health status, which will be through email on weekly and monthly basis. And our competition is Boy Baby Center, which is one-time data collection, and Pinnacle Care, which does traditional advisory. And unlike our app, which is personal just for you. And our business model is we'll enter the market through clinics to hospitals and hopefully to the general market in the foreseeable future. And for market validation, just in 2019 alone, $750 billion and 23 years of life were wasted due to unnecessary services and misdiagnosis. And here for the health app market, it is trending. As you can see, in 5 years, it will be by 33.3%. And so we have a huge market to enter. And for revenue streamlines, we'll have our short-term revenues from newsletter advertisements, membership fees, and etc. For long-term, the big data collection will be beneficial for research studies. It will be beneficial for Ministry of Health, government, and health sectors. And here's our team: Dimbe, myself, and Zenchu, and Yu Song. And thank you, and stay healthy.